Did you know that 7 out of 10 Americans who have medical bills say that they have to lower their spending on food in order to avoid a medical bankruptcy? Navigating our highly complex world of healthcare and health benefits leaves many people feeling like a snowball in, well, you know where. I'm Josh Butler, healthcare consultant and advisor to more than 150 employers around the country, and this is A Snowball's Chance in Healthcare, a show about restoring hope in healthcare. Join us as we discuss ways you can lower your healthcare and benefits costs, how companies are winning the healthcare and benefits battle, and how hope is being restored to this community and communities across the country. Hello, everyone. Good morning. Another Saturday morning in the Texas Panhandle. Welcome to A Snowball's Chance in Healthcare. I am Josh Butler, your host. I'm the president of Butler Benefits Consulting. We are a boutique healthcare consulting and brokerage firm right here in Amarillo, Texas. And each week we're talking about topics and information and things that help employers and families reduce the cost of healthcare, giving you a snowball's chance in healthcare. So many times companies and people feel like there's nothing that can be done to impact the cost of their healthcare or their health benefits. And we know that's not true. We know how we help our clients each and every day. And today I've got a guest on our show. Micheal Smith is joined me today. And for those of you that are watching the video version through our website, you can see Micheal right there in the camera. Say hello, Micheal.
Hey.
Micheal joined our team at Butler Benefits. What, Micheal? It's been...
Back in January, actually.
Yeah, back in January. So you've got about 6 months under your belt with us. And how's it been so far? No pressure.
Fabulous. Actually, it's one of the highlights of my career right now.
Awesome, man. Well, let's talk a little bit about your career because, you know, you and I have been friends for quite some time, and we've talked over the years about working together. You know, how can we make this work? And, you know, and 6 months ago, the stars finally aligned, and we were able to make you an offer you couldn't refuse. You could have, but, you know.
But I didn't.
But
so,
you didn't, and
yeah.
we're so grateful that you didn't. But you have a little bit different background than me. You know, my background comes from employee benefits. It comes from the insurance world as a broker, as a sales rep, you know, for an ancillary carrier for many years. But your background actually comes from the other side of healthcare, kind of like the administrative side of healthcare. Tell us a little bit about your background.
Sure. So first off, thank you for having me.
Yeah, you bet.
Actually, I've spent about 20 years on the healthcare administrative side of the business, working for a variety of different hospitals, physician groups, surgery centers, and whatnot. And, you know, this has really been, you know, where I thought my calling was within the provider side of healthcare. But as we've started talking and our friendship has grown, it has really been something that my eyes have been opened to a lot of different things outside of the provider space. And so the more that we've continued to grow our friendship, it really made more sense and had more of I think, a passion and direction for me to come over to this side of the healthcare business and industry. But you know, it's been a wonderful transition, honestly.
Yeah, and I can say likewise. I mean, you bring a perspective to Butler Benefits that is very valuable, where, you know, we come at it from a payer perspective predominantly. You know, we work with employer groups that are paying for health care. They're paying for health insurance. And you come from a world where you were on the receiving end of that. And so we get to kind of get it from two different perspectives when you and I talk a lot to local companies and local employers and some employers that aren't so local, right?
Yeah.
I really do appreciate your perspective that you come from the administrative side of healthcare, but from the provider and the clinical side. And that really is something that I think is extremely valuable in the conversations that we have with clients. And so today, you know, I mentioned something at the top is that when we're out there, and you can attest to this, and you know, Micheal, when we go talk to employers in any market, whether it's here in Amarillo or if it's in Tennessee or Florida, wherever we're talking to employers, there's a common sentiment that a lot of these employers have, and it's this frustration, it's this doubt, this disbelief that anything meaningful can be done to lower their healthcare costs and lower, the cost of benefits. And so today we're going to talk a little bit about something that we know that that's not true. There's lots of things employers can be doing. And kind of tee this up, Michael, and let's talk a little bit about High Plains Health Plan. And you can kind of tee it up, and we'll go from there.
Yeah, sure. But before we get started with that aspect of things, I do want to say, first and foremost, congratulations on your most recent accolades. For those of you who don't know, Josh was both nominated and won an award, national award, by a publication, national publication, Benefits Pro magazine. And so I do want to make sure that, that has been, put out there, and it's a wonderful distinguishment.
Yeah, thanks so much. We were very fortunate to be named Broker of the Year, and I wanted to say thank you for that, Michael. I appreciate that. And it's really a team award, even though it was an individual award. I was named the Broker of the Year. But it's really, I think, because of the work we do as an organization, as a firm, and we're going to talk more about that today. We're very excited about the honor. Thanks so much for embarrassing me, and Michael knows I don't, like to talk about stuff like that much.
My pleasure.
But anyways, it's a very, very humbling experience, and we've gotten so much feedback from people in our industry and our clients, and we're very, very grateful. But I think people have asked me, well, what are the criteria of winning that award? And I don't know the full criteria. I know it's not a popular vote or anything like that. There's probably a board of people that make the final selection for that award. But like I said, it's a team award, and I want to talk a little bit about one of the reasons I feel like we garnered this recognition and got this award, and it's because we've created High Plains Health Plan. Mm-hmm. And so let's talk a little bit about High Plains Health Plan, Michael. It is a health plan. Tell us who High Plains Health Plan is for, and kind of give us some of the highlights and the of what the plan's benefit design looks like.
Sure. So High Plains Health Plan is it's a very different type of a plan that most employers are really not familiar with. Especially employers who are fully insured or employers that just have not had the type of options put in front of them that they even knew was possible. And so, the different companies and clients that we deal with on a daily basis, when we start talking with them about options and alternatives, related to having a $0 deductible for their employees. They take a step back and they just think, you've got to be kidding me. That's not even possible.
Disbelief, right?
Yeah, right, exactly. And so you start to, lay this out for them as to what is possible and how these options are going to benefit not only their company, but more so their employees. And they take a step back and they say, hold on, this has got to be way too good to be true. What's the catch?
Yeah, that's always one of the first initial reactions is like, this sounds a little bit too good to be true, because for those of you listening, if you're an employer or you're an HR manager, we're going to talk to you directly. These plans, like High Plains Health Plan, they lower the cost of healthcare anywhere from 20 to 40%. And we have multiple clients today that are within High Plains Health Plan. Now, we just launched this plan a few months ago, and we've already have several employers that are actively participating in this plan. But alluding to back to what you were alluding to, Michael, the plan boasts benefits like $0 deductibles, $0 copays, $0 out-of-pocket responsibility for members for many, many different healthcare-related services. And at the same time, it's still driving down operational costs 20 to 40%. And that, Michael, is really the ghost that employers have been chasing. Every employer we talk to, have we ever talked to an employer that says, I wish my healthcare costs would go up. Man, I wish my health insurance would go up. It's really cheap.
It's quite the opposite. They're really they're coming to us with challenges, problems. Looking for alternatives that can do the complete opposite of what they've been facing.
And I think in our industry, I want to touch on this for just a second because I think that for years we've had this mass exodus towards high deductible health plans. And the way that companies have been trained to get premium relief is to just raise their deductibles through the roof and raise their coinsurance amounts on employees.
Exactly.
And we kind of use that analogy of that's kind of like rearranging the deck chairs on the Titanic.
Yeah,
right?
It is.
Raising the deductible from $5,000 to $7,000, yes, it's going to lower the overall premium of that type of plan, but is it really reducing the cost of healthcare? It's not. It's just shifting more risk. It's shifting more financial responsibility to the member, to the employee. And, you know, we've talked about this many times, even on this program, about the number one cause of bankruptcy in this country is due to a medical event.
Correct.
And 72% of those people had what?
You know, they had insurance.
They had insurance.
That's the issue in and of itself. They had insurance.
They had insurance. And so, you know, so many studies have come out about how the vast majority of Americans cannot even afford an unexpected $1,000 household bill.
Correct.
And so we have to start to analyze. When people ask me, why did you create High Plains Health Plan? This was the predominant reason. Is we started to see the impact that high deductible health plans are having on individual households in this country. And so when people ask us, how on earth can you lower costs 20 to 40% and still offer a $0 deductible? So let's talk because I mean, would you say at Butler Benefits we're a transparent organization?
Completely transparent.
We are very, very transparent, and we share ideas. We don't try to keep solutions and ideas completely to ourselves. We are talking to other brokers from around the country, other organizations around the country. When they ask me, how is this even possible that you can do this? I think the best way to tell the audience today how we do this is I want you to tell the story, and because you had only been with Butler Benefits for what, a couple, maybe
probably about 2 weeks.
2 weeks, okay. Yeah. And Michael and I have had a lot of conversations over the years about how we drive down the cost of healthcare and things of that nature. But it wasn't until he became a part of our team that he got to witness firsthand exactly how we do this. And so I'm going to set this story up real quick. It was a member from an employer client of ours that just got prescribed a very expensive medication. That employer is self-funded. They are self-insured. And a woman had been diagnosed with a condition, and she needed a medication. And Michael, you take it from there.
Sure. So this particular medication was a specialty medication that is typically taken by patients who either have like ulcerative colitis or rheumatoid arthritis. So it's a very specific medication that you don't typically need unless you have a rare condition. So this patient was going to end up having to spend about $250. That was their monthly spend.
Our copay.
Copay, $3,000 a month.
No, $3,000 a year.
Yeah, a year. And that was really going to be the biggest drawback for that patient was they couldn't afford $250 a month. So,
but what was the total price of the drug?
Oh my goodness! So the entire all said and done, $85,000 for annually for this particular medication.
That's $85,000 a year, ladies and gentlemen, for one prescription drug. And like Michael said, this employer was self-funded, so the member's copay was $250 a month. So that's about $3,000 a year. The drug's $85,000 a year. So the plan was going to be responsible. The employer directly, since they were self-funded, is directly responsible for about $81,000 of that.
Correct.
And then the member would be responsible for about $3,000. All right, keep going.
So we worked tirelessly with the member, the employer, the patient's physician and their clinic, as well as the medication manufacturer. Yeah. And after a couple of days, we were able to align everyone and get all the documents and other information that was needed put together, and we were able to source that same medication that the patient was going to go to the pharmacy and purchase themselves. We sourced it for no cost, zero. Nothing.
$0.
Yeah, that's it. Yeah.
So let's think about this for a second. the employer's sitting there facing, because this drug was covered by their health plan, and so the employer was about to be on the hook for $81,000 a year for a specialty med that's covered by their plan. The member was going to be responsible for the $250 a month copay, and we were able to get it at no cost. Now, I just want to it's fun to do this. This is the type of work. So the audience can see that how are you able to reduce healthcare costs and eliminate patient responsibility. This is one way that this is a literal story where we did it for a woman. So I want to take a second because that's a huge amount of savings for one prescription drug. $85,000 got saved, right?
That's right.
$81,000 by the employer, okay? Saving that employer $81,000 was really cool. They were extremely appreciative, right?
Of course they were.
And it was great that we could save them that money. But here's the bigger story that I want everybody to really latch onto here is this family was considering, prior to this solution, not filling this medication because they were going to struggle to afford the $250 a month copay. Now that we've eliminated the copay, a woman, is getting a medication that she needs to treat her condition that she might not have otherwise been able to afford to get. That's the literal difference between a person getting the care that they need versus not getting the care that they need. And to me, and I know I'm going to speak for you when I say this, that's what motivates me. That's what, saving companies a lot of money, that's great, and it's very good for business. It's a great economic stimulus for that business. But it's life-changing for people when we're able to. This is one example. We have solutions in multi-areas, not just prescription drugs, where we can help self-funded employers really mitigate the cost of healthcare.
Absolutely. A couple of other examples, outpatient surgeries.
Yep.
We have the ability to go through and have a substantial discount off of what it is that a patient would typically go out and have a surgery performed. Diagnostic imaging, so CT scans, MRI exams, those are the types of things that people are paying thousands of dollars for when we can draw that down to only just a few $100s. So it's miraculous.
Yeah, and it's just, at the end of the day, though, you have to, employers have to have a plan. You can't just be cash pay, right, for everything. No. We do believe in insurance, but employers need a plan that administers these types of solutions and these types of strategies. And in a lot of health plans out there, they wouldn't allow us to leverage that strategy where we mitigated that drug by $85,000. Not all health plans will accommodate those strategies.
No, they won't.
Yeah. So therefore, this is why we've created a plan. It's called High Plains Health Plan. And this is how we proactively manage risk. And because when you're self-funded, that is the name of the game, right, Michael?
It is.
It's not self-funding. We say all the time, self-funding is not a solution in and of itself.
Nope.
Right? So we've got a client down in Miami, Florida, right? Yeah. And they own car dealerships, and they really appreciated this analogy. To me, self-funding is the right path, right? We believe that.
Totally agree.
It's the right vehicle for employers to manage risk through, right?
But it's just a vehicle, right?
It's just a vehicle, even though it's a high-performance vehicle. So I liken it to this. It's a sports car. It's a Ferrari, right? Mm-hmm. And if it's a high-performance vehicle, right? But if I put my 11-year-old son, if I put Brooks behind the wheel of a Ferrari...
Watch out.
Somebody's fixing to get hurt, right? And so even though it's the right vehicle, you have to operate the vehicle in a certain way to get results out of your self-funded plan.
That's
and it's
right.
all about risk management. So for those employers out there that are listening, if you're already self-funded, just being self-funded is not a solution in and of itself. What self-funding allows for is your ability to manage risk, right? And through strategies like we just outlined in the story.
And so you paint a good picture right there. And what I liken about Butler Benefits and Consulting is that we're the Mario Andretti of self-funded plans, and having the ability to have the right driver with you in the driver's seat to help guide you along, rather than having Brooks, your 11-year-old son, in the driver's seat. That's really how we liken, the ability for us to help advise in those types of situations.
Well, one of the taglines of this program is it's a show about restoring hope in healthcare.
Sure.
Because we see a lot of hopelessness out there, a lot of frustration. Like I said, what we said at the top of this show was, we're met with so much frustration. Employers don't feel like there's anything they can do.
Correct.
What this does is it restores hope. It gives employers hope that, no, as a matter of fact, there is something that we can do. There is something we can do differently to address this aspect in our business. Because 25 years ago, Michael, what? Health insurance and employee benefits probably registered where on the P&L?
Maybe 20, 30?
20, 30, it was way down on the list.
Way down the list.
That's how I got the nickname fringe benefits, right?
That's right.
But, today it is not uncommon. It doesn't matter what industry a company's in. Employee benefits rank in the top 5 in every P&L in the country.
Easy.
And, there's that, we know this through, and we've heard this saying a lot, is that each and every year, General Motors, GM, they spend more every year, and this is a fact, you can look this up. GM spends more every year on healthcare and employee benefits than they do on steel to make cars.
That's mind-blowing.
Starbucks is the same way.
Yeah,
they
are.
spend more every year on healthcare and benefits than they do on coffee beans.
I can't imagine.
So, well, we can imagine, and if business owners out there, they're probably shaking their heads like, I can imagine. I know what I'm paying. I know what we're paying. And so I think that it's just gotten into this, companies are being priced into alternatives. They're being forced to look at alternative solutions. What do you agree with that when you're out talking to clients and you're talking to prospective clients out in our community? What do you get that feeling?
I totally get the feeling. And so the majority of the time when I'm sitting in front of a business owner, an HR professional, a CFO, they come at me with, I don't think that there's anything else we can do. We've tried, changing carriers. We've tried, XYZ strategy. But at the end of the day, they feel like they don't have any control and that there's no flexibility within the plan that they currently have.
Yeah, and it's true. If you're just buying a health insurance policy, you don't have any say over the rates that got negotiated.
No.
You have no say over what gets paid for healthcare-related services. So a lot of times when we pull claims reports, employers are shocked. They're shocked. I'll tell you a real quick story. I think
Sure.
I probably told Michael this story before, but we got a client one time that finally had agreed to give us their claims data. They were a self-funded employer, to give us their claims data. And we start to go through this claims data, and we find something in their claims data. That company had literally paid $15,000 for a single abdominal CT scan, and nobody caught it. We caught it. We caught it in the data, and when we started to follow up and pursue, is this a mistake? Was this a miscoding? Was this just a outright overpayment? Was this fraud? Why on earth is somebody paying $15,000 for a CT scan we get for how much, Michael?
About $475.
$475. This employer paid $15,000. And his face turned about as red as a Dixie cup, right? And so we dig into it, and it was just no one was paying attention, and it got paid. Ultimately, we got a big majority of this refunded back to this employer. Yeah. And that's when he said, you're hired. And so it's just proactive management is that, employers need to know that they do have alternatives. They do have more control over what they pay in healthcare. And we're doing it through a very specific plan that we have named High Plains Health Plan. It is available to any employer in any industry as long as you've got 25 employees. We're working to move that down to even smaller companies, but right now it's offered to companies with 25 more employees. We're coming up on short of time, but Michael, any last words? You want to add anything about High Plains Health Plan or anything else?
Yeah, I think that employers who think that they don't have any control, think that there are no options, maybe that they're tired of these double-digit increases that they're receiving year over year from their current health insurance carriers, there is an alternative. You do have an option, and it is there to restore hope, like you said earlier.
Yeah, absolutely. And we've already got a lot of employers doing it. So
Absolutely.
hopefully, we're spreading the word, and we're having a lot of conversations, and we'll continue to do that. But anyways, well, it's been a great episode, Micheal. Thank you for joining me, and it's been great. And we'll get back out and we'll start hustling. But thank you for everybody for listening. My name is Josh Butler. I'm the president of Butler Benefits and Consulting. You can learn more about High Plains Health Plan. You can reach out to us at our website at butler-benefits.com. That's butler-benefits.com. That's our website. You can connect with me on LinkedIn. Connect with Micheal on LinkedIn. He's pretty active as well.
Absolutely.
Our numbers at the office are 806-350-3158. And we're located just off Wolflin, right behind Crunch Fitness, if you ever want to come by and see us. But each week, this is a snowball's chance in healthcare. This High Plains Health Plan is giving employers a snowball's chance in healthcare. Next week, we'll have a brand new topic. But until then, thank you guys, and God bless. Have a